So anyway, frequently asked questions. Why do we need an update? Isn't the LWVS current position adequate? And we've talked about that. Does anybody have more questions on why it's not adequate right now? It is, I think it would be adequate if it would be interpreted consistently to include healthcare, and it would be interpreted consistently to approve deprivatization when the contractors are failing to deliver, and if it would say healthcare cannot be for profit, that the fiduciary responsibility cannot be to shareholders. It can be privately delivered, but not for profit. Okay. So number two, why does Vermont consider the topic of privatization so important in healthcare? Does anybody need more conversation on that? Oh, okay. I think we can save our time on that one. Do you propose that the Vermont update replace the LWVUS position? No. So it doesn't replace it, it adds to it. It's an update to be added to it. And when we said we wanted to create a position, they said, do you want to have it be a new separate position? Because that's been done before, like you'll have two agricultural ones, and a few years later, they'll add them together. But we said, well, what do you think? How should we do it? And they said, well, what did you think about the way the healthcare position was updated a few years ago by just adding behavioral health at the end? And we said, sure, whatever. Like, I would rather they just inserted the word healthcare in that other paragraph and inserted one sentence about deprivatization. I would be happier to just have it integrated in, but if they, by whatever rules, they prefer to just lump it at the bottom, that's okay with me. But I wouldn't replace it. Is the proposed update intended to add to the LWVUS healthcare position or the privatization position? It's definitely to add to the privatization position. Is your position that there should be no private options available at all? So no, in Vermont, all of our hospitals are private. We don't have any public hospital. None of them is paid for by taxes. So it may be that monies that you pay on your state income tax go to the state, and they may distribute some money to those hospitals, but not by a long shot all of it, right? They bill Medicare, they bill private insurance, they they do fundraisers, they do a variety of things, but they are not dependent on taxes. We also have what we call designated agencies, which are mental health agencies around the state, and each one is responsible for a certain catchment area or geographic region, and they get some funding. They also bill Medicare and Medicaid and whoever whatever is the coverage for those services. But they do get some funding from the state too. And we're not proposing that they all have to be funded only by the government. It wouldn't make any sense. Why would you throw away that money? I mean, I guess you could have the state bill all those insurances and all, and then the state pay the lump sum to the designated agency, but it's working okay the way it is. We wouldn't spend time on advocating that. We have better things to do with our time. And we definitely support having independent practitioners, a local doctor or a clinic that has several doctors running it. We're fine. The federally qualified health centers are a public clinic, and that could be a model. That could be like, the VA for all. But we're fine with having Medicare for all. And we're fine with, we're fine with having privately delivered. Everybody in our healthcare committee and on our privatization study committee and on the state and nationally, everybody in the interest group all support single payer, but that's in the healthcare position and we don't need to restate it here. Okay. So, without definitions and descriptions of the process for taking control of currently and historically private health services, would we be inadvertently manipulated into supporting a move that was unintended? And that was the one about Planned Parenthood. Would we be required to advocate against Planned Parenthood? No, we would not. What are the criteria for failing to deliver? And that is in that bullet list that we saw in the national position, those two bullet lists. Okay, I'm going to stop sharing now. I think I will. Oh, there it is.